Thank you for joining us today to learn more about COVID-19 vaccination in Iowa. My name is John Lawrence, and I serve as Vice President for Extension and Outreach at Iowa State University. Iowa State is one of more than 100 land-grant universities across the nation promoting vaccine education. And while we are not a medical research institution or a healthcare organization, we do have a strong network in every county throughout the state, which allows us to reach many Iowans at once with information and education. Our role today is to provide an opportunity for you and all Iowans to engage in discussion about COVID-19 vaccine and connect you to the experts who can answer your questions. As you think of your questions along the way, add them in the question and answer box, and we'll answer them at the end of the session. Providing the answers today are our partners, the Iowa Department of Public Health and the University of Iowa College of Public Health and Institute of Clinical and Translational Science. Together, we're committed to ensuring all Iowans have access to information about COVID-19 vaccines and are providing Iowans with opportunities to learn more about the safety and effectiveness of COVID-19 vaccines, ask questions, and to hear from medical experts. This evening, you'll hear from two medical and public health experts, Dr. Caitlin Padatti and Dr. Pat Winokur. They will give you facts, help you understand the research, and share their insights about COVID-19 vaccination. They will also answer your questions in the latter part of the hour. We are grateful for their collaboration and tireless work to keep Iowans healthy. Our first speaker is Dr. Pat Winokur of the University of Iowa. Dr. Winokur is Executive Dean of the Carver College of Medicine. She is also the co-director of the University of Iowa's Institute for Clinical and Translational Science and is a professor of internal medicine specializing in the area of infectious disease. Dr. Winokur, thank you for joining us today.
So thank you for having me tonight, and thank you all for joining. We want this to be more of a conversation tonight. Dr. Padatti and I will give you just some basic backgrounds of how these vaccines were created and some of the situations that are going on in Iowa today. But really, we want this to be an hour where you can ask questions and we can answer your questions and really drive it by what you're interested in hearing. So I'm going to start a little bit telling you how we got to the vaccines that we have today. And this is a story that has a little bit of a silver lining. And for many of you, you don't think this pandemic has much of a silver lining, and I think most of us would agree with that. But we were really advantaged in getting these vaccines by two major things. One is in 2002, there was a coronavirus that was identified in Asia and also spread to Canada. And it was a virus very similar to what we're seeing this year. It was a virus that caused severe disease and could spread very rapidly from person to person. And there were a lot of people that thought that that virus, which was called SARS, was going to spread around the world and cause a pandemic. We were lucky, we were able to contain it. In 2012, there was another coronavirus. This was identified in the Middle East. Again, very serious disease, and we were very concerned that this also had the potential to become a pandemic. Again, we were lucky. But because those two viruses caused so much anxiety and had so much potential for causing a pandemic, there was a lot of scientific evaluation that went on to understand these two coronaviruses. The scientists really understood what was causing disease, how these viruses got into the cell, and what they found was there was a spike protein that was on the outer surface of the viruses. And that spike protein was critical for binding to the human cell and allowing the viruses to get into the cell and cause damage. But what was also interesting about the spike protein is because it was such a prominent piece of the virus, it was what our bodies mounted a very important immune response to. And the antibodies that were generated to the spike protein seem to be very critical in helping people overcome this viral infection. The scientists went on and did a lot of studies in animals, really exploring the immune responses, and again, continued to hone in on that spike protein. They made vaccines to the original SARS and then that MERS virus, and they tested them in animals. That scientific evaluation that started almost 20 years ago has really paid off when we identified this third coronavirus that was identified in 2019 that ended up unfortunately spreading around the world. But at the same time, the second thing that really helped us with creating vaccines was that we, for the past 15 years, have been working very hard to improve our vaccine technologies. And we know every year we have to make a new flu vaccine. We often have to do it pretty quickly. We needed ways to create faster and better vaccines. And so a lot of scientists have been working on creating these better vaccines. Together, understanding that the spike protein is so critical, and then having these new platforms that had even been tested in humans with different virus inserts helped us create the vaccines that we have today. And we have 3 vaccines today. We have the Pfizer, Moderna, and Johnson & Johnson vaccines. And let's talk a little bit about those 3 vaccines. So interestingly, these vaccines, though they're all different in many ways, they share one significant piece. These vaccines essentially present your cell with a blueprint or an instruction manual. When you get a vaccine with these 3 different vaccines, get immunized, these particles go into your cell, and your cell has all the building blocks to make that spike protein, and only the spike protein. Once you've made the spike protein, it's transferred to the outer surface of the cell where your immune system sees it and makes antibodies. And we know that these antibodies are protective. So very similar technologies in how they get the spike protein delivered to your immune system. In the old days, what we would do is the manufacturing plant would create that spike protein. And when we gave you a vaccine, you were getting a pre-made protein. These new technologies are faster to make, and they're very effective at creating a very intact spike protein that very much mimics what we see with the virus itself. Once we had the vaccines, many of you have thought, well, you know, I think people skipped steps and we got these vaccines out into the general public too quickly. Let's talk about that. If you look at how we create a vaccine under normal circumstances, what happens? Well, first, we do a lot of that animal work and try and understand what is the best part of a virus to expose to your immune system. Once we figure that out, we create vaccines and we test them in animals. And we look to see whether the animals have any symptoms, do they have any side effects that we don't want to see, and are those animals protected from infection? Did we do that with these vaccines? The answer is absolutely yes. Once we have developed that understanding of a vaccine that is safe and effective in animals, we move it into testing in small numbers of people. And small because really at that point in time, we're focusing on safety. And we are doing all sorts of laboratory tests, electrocardiograms, other things that we can think of to prove that those vaccines are safe in people. Once we've done that, we move into a larger group of people. At that point in time, we're really honing in on the exact dose that seems to be the best dose to pick. And finally, we get into what's called a phase 3 study. And this is the really pivotal study where we are trying to understand whether that vaccine is safe and whether it is creating that immune protection that we think is important. In the typical vaccine study, we test 2,000-3,000 people. That's a really important number. Remember 3,000. Did we do all of those things with the coronaviruses? Absolutely true. So now let's get into how we tested the 3 vaccines we have, Pfizer, Moderna, and Johnson & Johnson, in that very large phase 3 trial, because that's the key. We did the animal studies. We did those early safety studies in humans. We picked the doses. But then we went into big studies. I told you normally that we test 3,000 people in a typical vaccine study. Each one of these vaccines was tested in 30 to 40,000 people, 10 times more than we normally test. That gives us a lot of ability to study safety, and it also gave us a great ability to test efficacy. In these studies, half the people got what we call active vaccine. The other half got what we call placebo. In this case, salt water. That's what the placebo was. Because half got placebo and half got vaccine, we could test who came down with COVID-19 after they were immunized. And what we found is that these vaccines, all 3 of them, were highly, highly effective, somewhere between 70 and 95% effective. And what that meant is almost all the cases that we saw occurred in the people that got salt water. Those who got the vaccine, the active vaccine, were very protected from getting symptomatic COVID-19. We also looked very carefully at safety. Did we see any events that were worrisome? We found with all 3 of these vaccines that people did have side effects, but they were side effects that we see with many vaccines. Sore arm. People got a little headachy. They felt a little achy, low-grade temp. That was very common with all 3 of these vaccines. It lasted 24 to 48 hours, 1 to 2 days. When I did these studies, the people would tell me, boy, it was like the faucet just turned off, and I felt great. So that was what we learned, is we expect these side effects, but we didn't see any severe side effects that made us worried about the vaccines. After these studies were done, that data, along with the animal data, along with all those other safety studies that I talked about, that information was sent to the FDA. And FDA reviewed that data and decided that all 3 of these vaccines had a safety profile that was acceptable and their efficacy was outstanding, and they released them for use in the general public. But we don't ever stop once we have approved a vaccine or a drug at those studies. When we release those drugs or vaccines into the general public, we spend a lot of time watching very carefully, looking for unexpected events, things that maybe were only going to be seen when we had many hundreds of thousands of people or millions of people vaccinated. And that's exactly what we did with these COVID-19 vaccines. And that was where last Monday we had the events that were identified with Johnson & Johnson. I'm going to come back to those in just a moment and really focus on them. But at the same time as we were testing these vaccines and starting to get them out into the general public, the virus was doing some changes. Viruses make mistakes as they replicate themselves, and those mistakes can cause variants. And you have heard a lot in the press about the variants. You've heard the UK variant, the Brazilian variant, the South African variant. Well, one of the things that was really lucky is as we were doing these later studies, these variants were becoming prominent in certain populations. And it allowed us to study the efficacy of these vaccines, even in the face of these variant viruses. And the good news was that we found that the vaccines, though made to that original strain that was identified in December of 2019, were actually highly effective against these variants. There was almost 100% protection from severe disease and hospitalizations. So that was really reassuring, but we continue to watch those variants very carefully and watch the effects on the vaccine strains that we have. Okay, now let's come back to Johnson & Johnson because that's on a lot of people's mind. What was identified was 6 cases of a very rare blood clotting disorder that was also associated with low platelet counts. This is a rare, unusual form of blood clots. 6 cases. At the time we identified those cases, 7 million doses of Johnson & Johnson vaccine had been delivered. So that was 6 cases out of 7 million, 1 in a million. So a very rare side effect. But because we are always watching our vaccines and drugs as they're put out into the general public, I think the FDA and the CDC did the responsible thing, and they chose to pause the rollout of the Johnson & Johnson. What we know now is the cases were all in women. They were between the ages of 18 and 48. What they developed was severe clotting at the base of the brain, deep in the abdomen for the most part. These were not typical blood clots. That low platelet count is very uncommon with blood clots. The clots developed about 1 week to 3 weeks after they received the Johnson & Johnson vaccine. The symptoms that they saw were severe headache, sometimes weakness, like a stroke, trouble speaking with slurring, severe abdominal pain, occasionally acute shortness of breath because they release some of those clots into the lungs, occasionally swelling in the legs. Those are the types of symptoms, if you got the Johnson & Johnson vaccine, that you should be looking for. Severe events, not those common things that I talked about where you have a day or two of low-grade temps, feeling achy, headachy after the vaccine. These are much more severe, more persistent. Another very important thing is we have not seen these same events with the Pfizer or Moderna vaccines. We did see some similar events in Europe. They do not have the Johnson & Johnson vaccine there. They have another one, and the events were after people had gotten the AstraZeneca vaccine. Johnson & Johnson and AstraZeneca are both adenovirus vectored vaccines. It's a very different technology than the technology for the messenger RNA vaccines that are the Pfizer and Moderna vaccines. So keep that in mind. We have not seen that with the Pfizer and Moderna vaccines. We are on pause right now. The CDC, along with their advisory committee, are evaluating these cases. They have statisticians, they have clotting experts, they have infectious disease experts, all thinking about these cases, and they will be giving us some good guidance in the near future on how we should proceed with the Johnson & Johnson vaccine. We still think these vaccines are really effective, and we really encourage you to consider getting one of these vaccines. And we think there is a lot that will help us get back to a new normal and help us get this pandemic under control. And with that, I'm going to turn it back to Dr. Lawrence.
Well, thank you, Dr. Winokur. It's reassuring to hear you talk about the type of research that was done, that they've been working on this platform for many, many years. And the size of the trial, the number of people involved in the safety trial was 10 times the normal vaccine. So that's all great news. Our next speaker is Dr. Caitlin Padatti. Dr. Padatti is a medical director and state epidemiologist for the Iowa Department of Public Health. So Dr. Padatti.
Thank you so much, Dr. Lawrence. It's so nice to have the chance to be here with you all, with ISU and with our University of Iowa partners to have this great discussion. So we just heard a really nice summary of the really good scientific process that goes into the development of tools like vaccines, including the COVID-19 vaccine. I'd like to take a couple minutes now and describe for you how we use tools like the vaccine and why it's so important for public health. So remember, when we think about a pandemic, when we think about a new virus, part of the challenge is that we're talking about something that nobody's immune system has ever seen before. And so the issue is that we could all get sick and very sick at once. So from the beginning, part of this response, or really the focus of this response, right, has been to reduce the activity of this virus, so keep it from spreading among us, really focus on protecting our vulnerable populations who are at risk of having bad outcomes, needing to go to the hospital, and sometimes dying, and then preserving our healthcare resources so that they're available for all of the other healthcare needs that we might have as a community, including COVID, right? So when you start with that picture in mind, getting a vaccine is going to be a really important way to keep yourself healthy and protect yourself from ever having to worry about getting sick with this virus. And remember, that's where we always want to be on the public health side, right? Is preventing something bad from ever happening. And so having a remarkable tool like the COVID-19 vaccines that we have now, and to have them so quickly, with such a rigorous scientific process that we just heard about, is really an incredible public health achievement. It means that we have a chance to do something to keep ourselves healthy and not have to worry about getting sick with this virus. Now, there are some among us, right, who are maybe younger or don't have underlying health conditions. And so you kind of wonder, okay, well, if I'm not in that group who's at high risk of having a bad outcome, then is it really important for me to do this too? And the answer is yes. And there's a couple of key reasons why it's really important for all of us, not just those who are more vulnerable in our population, to take advantage of this vaccine. So one of the reasons is that unfortunately we're still learning about this virus. Remember, it's new-ish, I would say. And it does seem that there are some people who experience longer term symptoms from this infection than others. So you might have seen this called things like long haul COVID or chronic COVID. And so, like so many things throughout this response, this is an example of a place where we still need to learn more and we're still understanding more. But it's important to protect yourself from getting sick because we don't know what some of the long-term effects of infection with this virus might be, even for people who may have had more mild infections. Another really important reason for everybody who's able to take advantage of this vaccine is the idea of herd immunity or community protection. So, this is the idea that if enough people in a group, in a community, are immune to something, then a virus or disease or bacteria can't move between us. And so, in order to reach that level, you really need enough people to have immunity. And that means getting enough of us vaccinated. Now, the exact number that you need to reach herd immunity is going to be a little different depending on the virus or disease that you're talking about. And we're still learning about COVID. You've probably seen numbers like 70 to 85%. But again, it's a place where we need to learn more. But in the meantime, we've got this great opportunity to take advantage of a tool to protect as many of us as possible so that the virus doesn't have the chance to move between us. and we can effectively keep not just ourselves healthy, but also people who might not yet be able to get a vaccine, like kids or people whose immune systems maybe didn't mount as good of an immune response. And sometimes that can happen if, for example, you're somebody who has an impaired immune system. Maybe you're somebody who's receiving treatment for cancer, or you have an underlying disease where your immune system isn't quite as strong as it needs to be. And so, for that reason, having all of us take advantage of getting a vaccine to reach that level where a virus can't move between us is so important. And we're on the way, right? You can see in the numbers that we share, just over 2/3 of the population in Iowa has had at least one shot, and just under 1/3 has completed a series, right? And in some cases, that's the one shot of the Johnson & Johnson, and in others, it's that two-shot series of either the Moderna or the Pfizer product. So again, we're seeing people take advantage of this tool, but really want to encourage everybody to take advantage of it as soon as you can so that we can reach that level where we won't see transmission between us. I also want to talk a little bit about the things that we can do more and more of as more of us get vaccinated. So you've probably already seen there are some advantages and some relaxing of some of the practices that we've been doing for a long time now. So for example, if you're fully vaccinated, you can gather indoors without a mask with other people who have been fully vaccinated. And in addition to that, people who have traveled either here in the United States or even coming from internationally don't need to quarantine if you've been fully vaccinated. Now, remember, being fully vaccinated means it's been 2 weeks since you completed that series. And we need that 2 weeks because that's about how long it takes your immune system to learn how to recognize that spike protein and have the antibodies ready to go to fight it off if it were to see it. But once you make it to that 2 week point, there are some things, as I just mentioned, that you can start to do that we couldn't do before. And I fully expect that that list of things is going to continue to increase, and it will increase quicker the sooner more of us take advantage of this vaccine. But in the meantime, we do want to remind everybody to please continue to follow the public health guidance we've shared, which does include things like staying home when you're sick, practicing social distancing, and wearing masks. It's going to be important that we keep doing those as more and more of us get vaccinated. So I also wanted to talk just a bit about the different variants we've heard about. And Dr. Winokur described this as well, and I'm sure you've seen in the news a lot of information about the different strains of this virus and when we see it circulating in different places here in Iowa as well as in the United States. So similar to flu, when you hear us talk about something like an H1N1 year or an H3N2 year, we're talking about those different strains of the flu virus. And a similar idea is that we want to think about or be aware of the strains of COVID that are circulating. Now, it's important for a lot of reasons. It helps us understand the transmission characteristics. It helps us understand the outcomes. But really, the best opportunity, the best defense we have in terms of reducing the spread of this virus, no matter what strain it is to make sure that we all take advantage of a vaccine as soon as we can. With the idea being that we want to make sure that our immune systems learn how to fight this virus before this virus learns how to change too much. So the last thing I want to touch on is how to get vaccinated. So thankfully, we've continued to see vaccine supply expand in the United States and here in Iowa. And hopefully you should be seeing and hearing about those opportunities to go ahead and take advantage of a vaccine. You might hear about that through your local public health jurisdiction, maybe through your healthcare provider, or even through your local pharmacy. All of those are great options, and I would encourage everybody to take advantage of those as soon as you can. Additionally, any Iowan who's experiencing a barrier to scheduling a vaccine appointment or who maybe doesn't have internet access, for those who are 65 and older or 64 and younger with underlying health conditions, you can access our 211 line, and a vaccine navigator can help you with getting an appointment. So remember, everyone, all adults, here in the state of Iowa are eligible for a vaccine right now. It's free, no insurance is needed. And again, I would encourage all of us to take advantage of the vaccine nearest you as soon as you can. Thank you so much. And with that, I'll turn it back to you, Dr. Lawrence.
Thank you, Dr. Padatti, and appreciate your comments and understanding how these vaccines are still effective against the variants we hear about. But as you said, the key thing is how do we reach to a herd immunity to really shut down the spread of these viruses. It's now time for your questions and answers. So please put those in the chat box, the Q&A box, and we're going to start addressing those. I'd like to introduce my colleague, Andrea Nilsson, who will moderate our question and answer session. So Andrea.
Thank you, Dr. Lawrence. And at this time, we will begin our Q&A. We've been keeping track of the questions that you've been asking in both the WebEx and on the YouTube comments. And we'd like to encourage you to continue to add new questions throughout the rest of this program. And so we'll try to answer as many as we possibly can in the time remaining. The first question tonight, I'm going to go ahead and pose to Dr. Winokur. The question is, we aren't hearing much about new positive cases coming from reinfections. If the chance of getting reinfected with COVID is very low, why should someone who's had COVID get vaccinated?
So we have a lot of good test tube data on the antibody titers that people get after they have gotten COVID-19. And one of the things that we know is that the antibody titers are actually better after vaccine than they are after natural infection. 4, 5, even 10-fold higher. The higher your antibody titers, typically the longer those antibodies last. And so we know also with some of the other coronaviruses that cause the common cold, that it's pretty easy to get reinfected. And so we think getting that vaccine really helps boost your immune response so that your protection is going to last much longer.
Dr. Padatti, would you like to answer any part of that question as well?
No, I would just add, I know this is tough, but just like everything else, remember, this is still sort of a new virus, right? And so part of the challenge here is that we need time to pass for us to understand sort of how good immunity is and how long immunity lasts. And then again, we also want to make sure we're remembering that balance between some of these variants, right, where the virus has sort of mutated, changed, made a mistake or learned something new that could maybe impact our immune response, right? And so the idea here again is even if it's somebody who's had COVID, taking advantage of that vaccine is important because it reminds your immune system how to fight this, and it's going to help reduce that disease activity overall.
Thank you. Dr. Padatti, I'd like to ask the next question of you. Do you think the Johnson & Johnson vaccine will become available to the public again?
Yeah, I do. So I think that again, it's hard when we see things like changes in information or when we have to do something like a pause on a tool like a vaccine. And as challenging as that can be, it does mean that the safety and monitoring systems that we put in place are working the way that we want them to, right? We want to understand what's going on. We want to collect this information. And it may be that with a little bit more information, we realize that there are different questions we need to ask or different populations where we might target this vaccine in particular. So again, as you heard from Dr. Winokur, we've got some really great experts looking at this. We expect to hear more on this yet, towards the end of this week. And hopefully, I'm hopeful that we'll learn a little bit more, just like we have over the past year and a half, and we'll find the safe and appropriate way to keep using tools like this because they're so important.
Dr. Winokur, is there anything there you would like to add?
Yeah, I would just reiterate what Dr. Padatti said. It's not impossible that they might recommend using this vaccine for certain populations and not others. But I think this is where they're weighing the risks and benefits. And remember, we have, up to 1,000 people a day dying in the United States and many, many more around the world. And so we do still need lots of different vaccines. And remember, to get a pandemic under control, we're also going to need to have vaccines delivered around all countries in the world.
Dr. Padatti, you talked about long haul or chronic COVID. What percentage of positive cases could be counted as long haul or chronic COVID?
It's a great question, and the answer is we don't know yet. Again, if you think about the fact that this was a virus that was discovered in sort of December of 2019, right? And of course that we've all been working really hard to learn more about and to fight over the past, year and a half or so, but it is still sort of new. And so there are some things we don't yet know. And so it's an example of a place where it's really important for, public health, on the governmental side to work with, academic partners, to work with clinicians, and to work with you all to understand what you're experiencing, to keep track of that and to learn more. So it's a place where I would say we need to learn more. It's a place where anybody who's concerned about how they're feeling, I would always advise to talk with your healthcare provider. And then the other thing that I would just say is it's another reason why, taking advantage of a vaccine is so important to help prevent you or somebody you care about, from having to worry about something like that.
Dr. Winokur, anything about long haul or chronic COVID you'd like to add?
Yeah, so right now, the early studies, and I think Dr. Padatti said the right thing, is we don't know really long term, but the early studies where they're looking at people maybe 3 months out from their illness, about 30% of people still have symptoms. They might be mild, but they still feel that they have something that's not back to normal. Maybe it's their taste or smell, maybe it's just their energy level, or that brain fog that people talk about. But we are developing, many of the clinics in Iowa have COVID long haul clinics now. I know we do at the University of Iowa, and we are trying to really evaluate people carefully to see what symptoms correlate with what tests and get some of that information that's going to help us figure out how to best treat these people.
Thank you. So our next question, can you unknowingly transmit COVID-19 after being vaccinated? Dr. Padatti, you want to try to give that one a response?
Yeah, that's a really great question. So remember that one of the things we learned about this virus is that there are some people who experience really mild illness, or maybe even no symptoms at all. And so when you think about the process that Dr. Winokur outlined for how we develop vaccines, often you begin right by looking for safety and then you look for efficacy. Does it do what we want it to do? Does it keep people from getting sick with COVID? And so we saw, yes, these vaccines work great at keeping you from getting sick with COVID and having to go to the hospital or even maybe dying, right? And so that's wonderful. What we've also started to gather information on now, as we've increasingly used these, is once I've been vaccinated, does that also mean not just that I won't get sick, but am I less likely to be asymptomatically infected, right, and pass the virus to somebody else? And so it makes biologic sense. And in fact, yes, that is what we're seeing, that individuals who get vaccinated are not just less likely to become sick, but also less likely to be able to pass that virus on to anybody else. Now, the other thing I would point out, and I know it's hard, keep in mind that nothing in life is 100%, right? And so when you think about vaccines, and these are great vaccines, even with an efficacy of 90 or 95%, that means that maybe 5 to 10% of the time, there are some of us in whom it just might not work as well. Our immune systems maybe didn't learn that skill the way that it needed to. And so in order to make sure that we bring this virus activity down and that we protect the people among us who are most vulnerable, it really is so important that as many of us as possible take advantage of that vaccine so that we reduce the likelihood of that happening.
I'd also like to give you a chance to respond, Dr. Winokur, if you'd like.
I think that really said it quite nicely. We have had cases of people who have had COVID after vaccination. Many of them have compromised immune systems. they have had transplants or cancer drugs, as Dr. Padatti had said earlier. So it is really important to try to get as many of us that are healthy and can mount an immune response to kind of cocoon those individuals that just don't respond well to the vaccine. And it's kind of our way of helping our neighbors that maybe can't get the best immune response.
Dr. Winokur, I'd like to ask you this next question. What's the risk of getting blood clots with COVID-19 infection itself compared to the risk of getting them from the vaccines?
So that's an excellent point that they are getting at. COVID-19 itself is a virus that is causing people to clot very readily. And it is very common that they develop blood clots in the legs, sometimes in the lungs, sometimes strokes from blood clots. It is a common side effect of the COVID-19 virus infection, much more common than the 1 in a million that we're seeing with the vaccine. It's a different kind of clot. It's a different process, but much more common with the infection.
Dr. Padatti, would you like to respond to anything about blood clots?
Yeah, I think I would add this is a place where we continue to learn more. And I know I keep saying that, but it really is true. So there was an analysis, I think, out of Oxford just last week that kind of compared that given their experience over there with the AstraZeneca vaccine. And so I think they saw something like 39 people out of a million who were likely to develop a clot from having COVID versus about 4 in a million related to an adenovirus vector vaccine. But that question, I agree with Dr. Winokur, it's important and it's important to understand. And it's part of what we all want to know when we think about what are the steps we need to take to keep people as healthy as possible. And it's exactly that kind of information and that kind of analysis that CDC and FDA are looking at to help us understand, do we need to tailor the way we use some of these tools, with the ultimate goal still being, we want to protect as many people as possible and make sure that we're doing everything we can so that people aren't sick and, we can get back to living our happy, healthy lives.
So our next question here is, have you seen any indications that the COVID-19 vaccinations may need to become a seasonal event, similar to how the influenza vaccine is seasonal, or is it still too early to tell? So Dr. Padatti, would you like to answer that?
Yeah, I think I would say it's still a little early to know that for sure. But it is possible that we would find ourselves in a situation where once we learn a little bit more, this could look something like the way flu looks. Again, they're not exactly the same disease, but in a lot of ways, flu is a decent model. So remember that, there's a season with flu, and every year we look for the strains that are circulating. We create a vaccine to match them, to protect as many people as we can, right? And we keep track of flu activity so that we can help prevent that virus from moving in our communities. And in fact, what we experienced, what I'm sure you all experienced firsthand, was that a lot of the steps we took to reduce the spread of COVID also helped reduce the spread of flu, which makes perfect sense, right? They're both sort of respiratory viruses that can move from one person to the next. And so thinking about all of those things we do to help keep ourselves healthy during what I would call seasonal respiratory season are going to be important. And in fact, in addition to the severe coronaviruses that you heard Dr. Winokur talk about, which includes COVID-19, there are 4 more common, circulating coronaviruses that we see as part of respiratory viral season every year. And so I think, it's important to take what we've learned, scientifically from those other coronaviruses, what we've learned about COVID-19 over the past year and a half. We need a little bit of time to see how long immunity lasts, how strong it is, if the virus changes a lot. And then we'll start to have those conversations about, whether boosters are needed and what that would look like.
Dr. Winokur, any thoughts on the seasonal aspect?
I think we are getting some indications. Pfizer has been looking at the immune titers, the antibody titers after people were vaccinated almost a year ago. And they're coming down enough that they're pretty convinced that we will need a booster, at least until we can get this pandemic under control. And then we're going to be trying to understand what's happening in the world of coronaviruses every year to understand whether this is a vaccine we need, like the flu vaccine every year.
Dr. Winokur, this next question, I think I'll start with you. Could you please discuss any potential long-term effects of the COVID-19 vaccine? Is there a concern for long-term effects such as cancers or kidney disease down the road?
So there are no indications from the kind of natural history of the viruses that we can say, something with the spike protein is going to lead to a problem. People were very worried early on that they thought these messenger RNA vaccines could change your genetic code. And that one, I think I'm pretty comfortable saying these messenger RNA particles are extremely short-lived. They are starting to break down as soon as we inject them into your arm. They last minutes. And once they get into the cell, your body breaks down messenger RNA very readily. RNA does not insert into DNA. And remember, our genes are made up of DNA. So that's another reason why I don't think that's a worrisome finding. So right now, I don't think there's anything that I can see scientifically that worries me that there's going to be a long-term effect like that.
Dr. Padatti, would you like an opportunity to answer that question as well?
I would just echo everything Dr. Winokur said.
Thank you very much. All right, so on this next question, it is, if vaccinated people are fully immune after 2 weeks, why are you asked to wear a mask and social distance if you can't get nor transmit COVID to others? So Dr. Padatti, would you like to get that opportunity to respond to?
Yeah, that's a great question, and it's a perfectly reasonable thing to ask. But here's part of I think we're kind of in this assessment of trying to get more people vaccinated, right, and trying to keep that virus activity low. So remember, not yet everybody who is eligible here in the state of Iowa has had a vaccine. So we don't know that everybody, is immune at this point. There's still, people who aren't, right? And so in order for us to keep that virus activity low, we need to keep doing some of these other public health precautions to help keep the activity low among us, keep this virus from spreading. And again, you also want to remember, like we said before, these are great vaccines. They've got, really good efficacy. But even if you're at the 90, 95% level, that does mean that there are some of us whose immune systems just quite couldn't get there, couldn't quite mount that response. And we may not always know who among us that is, right? We have seen some cases, although thankfully rare, of people who have been infected after getting the vaccine. And so for that reason, until we really get to a higher level of protection, that idea of herd immunity or community protection, in the meantime, we do still kind of want to use those other measures to help keep that activity low. Remember, it's all of these things together that help us keep that virus activity down.
Dr. Winokur, anything about immunity after 2 weeks?
Yeah, so I think just reiterate a couple things that Dr. Padatti said. One, I was just informed today of a healthy 30s-year-old man who got COVID-19 after getting 2 doses of vaccine about 2 months ago. So it isn't perfect. And the other thing is, this is a really hard time. I think people are getting tired of masks. They're getting tired of the social distancing. And think of it a little bit this way too, as you are continuing to set an example and trying to remind people, and especially those that haven't gotten vaccinated or maybe are a little more vulnerable, that this is what we need to do right now. We need to wear the masks, get this virus under control. The faster we can get it under control, the faster we're going to get back to a normal existence where we're not even thinking about masks.
Thank you, Dr. Winokur. This next question is about the Iowa Department of Public Health. So Dr. Padatti, I'd like to ask you, there's a lot of hesitancy right now with the pause of the J&J vaccine. How is the Iowa Department of Public Health encouraging hesitant residents to get vaccinated?
Yeah, thanks. I think that's, an important question. So again, I understand that it can be, frustrating or hard when you hear about things like a pause on the use of a vaccine. But again, I want to say this means that the systems we have in place for monitoring safety are working. We want to know about these things. We want to learn more. We want to take the time to understand it and then to make the choice to use this tool for the right people in the right ways. So as frustrating as it can be to hear about a pause, it is indicating that things are working the way they should. But I do understand that that can make people feel a little nervous, right? And so I think that what's important is talking about it, right? So whether it's talking with your healthcare provider, talking with your local public health partners, we want to be able to give you the information that you need to understand why it's so important to get a vaccine, and that it is safe and effective. And so, I can tell you that the health department, we're always looking for ways to share that information. And sometimes people like to get information in different ways, right? Sometimes it's a webinar, sometimes it's reading about it, sometimes it's having a conversation, sometimes it's coming from doctors like Dr. Winokur and I, and sometimes it's coming from other trusted sources. But we always want to make sure at IDPH that we're giving everybody the tools and the resources that they need so that you have access to accurate information so that you can make the safe and healthy choices for yourself and for your families. And so I think these conversations are so important. I encourage everybody to have them with their healthcare providers, public health, and trusted resources. And I am always open to feedback on ways we can continue to learn and do that more.
Dr. Winokur, I'd like to ask you this next question is just to help reiterate. Can you tell us what is the status of using the J&J vaccine again?
So right now it is on pause. And during this pause, the CDC has brought forward a committee, it's the Advisory Committee on Immunization Practices, that is working with all sorts of consultants and experts trying to understand the data, how common this is versus how risky the virus itself is. And they're going to come up with recommendations probably in the near future. Again, we think by the end of the week, but if they think they need more time, they'll take more time, and that's what we want them to do. So it's on pause. It is not canceled.
So this next question, I would like to go ahead and ask of you, Dr. Winokur. Upon vaccination with mRNA vaccines, which cells of vaccinated people are stimulated to produce the spike protein?
So mostly it is the vaccines injected into your upper arm, and the muscles, the cells in the muscles will take it up. And there are also a few cells that are called dendritic cells, which are immune system kind of surveillance cells that will come around and can pick up the mRNA particles, and they will make the spike protein and display it on their surface.
Anything you want to add there, Dr. Padatti? No, okay.
No, that sounds great. Thank you.
Oh, I have a follow-up piece on that one, Dr. Winokur. Following vaccination with mRNA vaccines, how long do host cells of vaccinated individuals produce the spike protein? In other words, how and when do host cells know to stop producing the spike protein?
Well, so that comes back to that whole concept that the messenger RNA is very short-lived. And so once we inject that mRNA, the cells take it up, they start to make spike protein, but at the same time, the messenger RNA is being broken down. So it is a short term that these cells are making the spike protein, but it's fast enough. It's interesting that the immune system is as robust as it is, that it can find those foreign proteins and make antibodies, which is what we want.
I agree. Fascinating. So, Dr. Padatti, I'd like to ask you this question about what is the time frame for children's COVID-19 vaccines in Iowa?
Yeah, so as a pediatrician, I'm always glad to hear us talk about kids and make sure that we're keeping them in mind too and their health needs. So right now, we don't have a vaccine available for the pediatric population. And again, that's one of those reasons why it's so important for all the rest of us who can get vaccinated that we do that, right? So that we can protect our kids here in Iowa. But we do know that there are ongoing trials of the currently existing vaccines that looking at their efficacy in the pediatric population. And I think we're hopeful that we'll start to get some more information about those soon and be able to use those tools. But again, just because we haven't necessarily seen kids be a primary portion of the population affected by this. We have seen some unfortunate, rare things like the multi-system inflammatory syndrome. And we want to make sure that we're doing everything we can to protect our kids while we await those additional vaccines.
I'd like to go ahead and ask this next question because we have very little time left here. So, can you define under control? What does that mean? Many counties in Iowa are at 3% or lower positivity rate. How will we know when this is over? Dr. Padatti, you want to try that question?
That's a great question that I think many of us would like to know. I think from the beginning, right? You've probably heard me say things like, "There's not one thing we look at," and there really isn't. So it's not just percent positivity. It's not just the number of cases. It's not just hospitalizations. It's everything together. And so you'll often hear me talk about virus activity. And again, I think flu is a nice model for this. So every week, the Iowa Department of Public Health during, flu season reports on flu virus activity. We issue those reports on our website, and you'll see they include things like the circulating strains, how many people were hospitalized, what kinds of influenza-like illness rates do we see? What does school absenteeism look like? What are the percent positivities and the case counts? And we look at things like death, right? You take all of that together to understand an activity level, and really those are all the things we've been looking at all along for COVID, right? And so again, what I would say is important here is not necessarily a single benchmark, not a single number, but we want to bring down virus activity. We want to protect vulnerable people who could get really sick or even die. And we want to make sure we keep those healthcare resources available for everybody who needs them. And that continues to be the goal. And thankfully, we've now got some really great preventive tools to help us reach that goal.
Dr. Winokur, I'll give you the last word. Anything about positivity rates?
I think we also have to remember that this is a global disease, and we have people traveling all over the world. And so it's really important that we try and get as much vaccine out in the United States, but we're going to have people that travel into the United States from other countries. Or maybe for work, you need to travel somewhere else. To get this pandemic under control, we have a big job, and that's to get vaccine delivered around the world. So looking at just Iowa is a piece of the puzzle, but there's a lot more to it.
Well, thank you to all of those who watched our program tonight and asked these questions. We've run out of time and couldn't get to all of them. However, our panelists here do have access to those questions, and we'll use it to prepare with other audiences and other Iowans who have questions for them about COVID-19 vaccines. So over you'll see on the right-hand side of your screen, we're going to open up 2 poll questions for you to take, and we'd like you to complete those if you would. And that concludes, of course, our Q&A portion. And now I'd like to return the program back to Dr. Lawrence.
Andrea, thank you for leading our Q&A portion of the program tonight. And thank you to those who joined us today with your insightful questions. We've reached the end of our program, and I want to extend our sincere appreciation to the Iowa Department of Public Health and the University of Iowa, with a special thanks to our two speakers, Dr. Winokur and Dr. Padatti, for joining us today. We hope the information that you've learned provides clarity around COVID-19 vaccination and empowers you to make the vaccination decision and plan. We encourage you to share what you've learned with your family and your community. And for anyone interested, we do have one more session, April 24th, Saturday at 10 a.m. The April 24th session will be presented in Spanish, and anyone interested can learn more at www.iowacovidinfo.org. And as Andrea said, before we adjourn, please be sure and indicate the answers to our survey questions. Thank you for joining us, and take care, everyone.